Right, so thank you for the global tallies over the past 24 hours. Here in Korea, authorities have voiced intentions to address surging demand for self-testing kits, and Choi Min-jung is here with details on that. Min-jung, welcome back.
Thank you for having me.
Right, so do tell us about the government's plan.
Well, Sunny, South Korea's Prime Minister Boo-kyum said during a COVID-19 response briefing today on Friday that officials are considering a price ceiling for rapid antigen test kits. The government has already banned the online sale of test kits from Monday to prevent scalping at marked up prices. Authorities said online bulk sales may lead to unnecessary stockpiling and make the test kits less accessible for ordinary people who prefer to buy them in small amounts. Officials also said offline sales will be limited to pharmacies and convenience stores only.
Right, and staying with these kits, Min-jung, the government is providing them free of charge to individuals in the high-risk category, though.
That's right, Sunny. The government has decided to provide the kits to students and staff at preschools, as well as those in senior care centers. Beginning on the 21st, rapid antigen test kits, enough for 1 or 2 tests per week, will be distributed to some 2.1 million people. Pregnant women may also become eligible to receive their free kits next month when the current supply crunch is likely to ease.
Right. Meanwhile, on the prevention front, Min-jung, are we looking at possible adjustments to our social distancing?
We are, Sunny. Health authorities are discussing possible changes to our current rules, which are due to expire on February 20th. Officials have suggested that the guidelines may be extended once again, but perhaps with eased restrictions. They will also discuss the fate of vaccine pass mandates once our current social distancing guidelines come to an end next week. This is what Korea's Prime Minister had to say about the matter in a briefing earlier this morning.
It is very important to adjust social distancing to minimize economic and social damage. After closely analyzing and evaluating the situation, we promise to make a bold decision when needed if the number of severe cases and fatalities remains stable and the virus situation can be managed to a certain extent.
Right, a bold decision, meaning perhaps an ease in restrictions, as you mentioned, Min-jung. Meanwhile, what's the latest with regard to Korea's treatment strategy for those recovering at home?
Right, there are close to 4,000 medical centers providing virtual treatment and prescriptions over the phone for home treatment patients as of Friday. Although services are becoming available at more clinics and hospitals with each passing day, there are still regional discrepancies. For example, medical centers that support low-risk patients are mostly concentrated in the Greater Seoul area, numbering around 1,200 as of Thursday. However, regions like Busan, Jeju, and Chungcheongnam-do province have fewer than 100, and in the city of Sejong, only 6. Health officials have promised to significantly expand their home treatment capacity, which is enough to manage 1.3 million people at the moment.
Right, 1.3 million at the moment. Min-jung, let's now include Soa in our talk.